Okay, today we're going to talk about what's termed the core. That's a very confusing topic for a lot of people. It means different things to different people, depending where you come from, where you look at it, where your background is. Specifically, I want to talk about the pelvic floor. It's a bit of a taboo subject, especially for men. We'll come on to that in a minute. The core muscles can be described as either the abdominal muscles for personal trainers, gym goers, bodybuilders. They generally think of the core as your six-pack muscles. They sit from your ribs down to the front of the pelvis, and they are moving muscles. Okay, they move your body from a lying position up to sitting. They move your legs over your head from a lying position. They also stabilise the body for upper limb movements. But generally they're large muscles which move the joints. The deeper muscles underneath, your transversus abdominis, multifidus, they generally are termed the core for people who deal with Pilates, yoga, physiotherapists, lots of sports therapists. These muscles stabilise your body. So when you move, they tighten to support your joints so they don't move excessively. People who, what's termed slip discs, which is not actually technically a correct term, should be disc bulge or can be a general cause of back pain. Often is caused because of lack of stability in the spine. These small muscles sit between the vertebrae, and as you move they tighten to hold the vertebrae together. Here. If they're not strong enough, as you move, especially small movements, the classic movement is picking something up off the floor or leaning forward and brushing your teeth. As you do the small movement, the stability muscle that isn't functioning properly, the large muscles are trying to do the two jobs at once, and you'll get a slip, a fast slip with the joint, and that causes a huge muscle spasm around that area. This is then where you get a large pain. That pressure down one side of the spine can start to squeeze the inner part of the disc out onto the nerve, and this can create pains down the leg, neural symptoms, burning, tingling, pins and needles, muscle weakness in the legs. There's a huge variety of symptoms that go with this. Some people term it sciatica. Again, that's a generalised term for pain down the back of the leg. But quite more often than not, the cause of this is a poor core or stability around about the abdominal area. Going on to pelvic floor. Again, as I stated, it's quite a taboo subject for a lot of people. Many men thinking about it as something that women do when they're pregnant. It's a big fear for women post-pregnancy. They worry they cough or sneeze, laugh, jump up down the trampoline, they're going to pee themselves because of a poor pelvic floor. Everybody has a pelvic floor. Pelvic floor is basically a basket of fibres, a hammock of fibres that sit on the bottom of the pelvis and holds everything in. But it doesn't create just this bundle of fibres at the bottom of the pelvis, it also creates bundle of fibres all the way up through the abdominal cavity. It helps support the abdominal contents, helps support the tubes of the vagina and the anus and the penis as well. If they're weak, it can cause all sorts of problems around the area. The majority of people nowadays spend time sitting. They sit to work, they sit in work, they sit on the way back home. Your body just adapts to what you do. If you don't use these muscles, they become weak, and that applies to any muscle in the body. If you don't use a muscle, it will adapt to what you're doing with it, and it will lose its ability to move. Same goes for the pelvic floor. If you don't use your pelvic floor, then it becomes weak. The abdominal contents sag down, you get less control around about the whole pelvic area. So everybody should be doing pelvic floor exercises. And that doesn't mean just squeezing. You can do a wide variety of pelvic floor exercises. The main one that people tell you to do is to squeeze the muscles to stop you peeing and pooing. You can do this at any time of the day. Morning, night, it takes 10 seconds. You can just squeeze these muscles and hold them. There's various sets of exercises you can do. You can squeeze and hold for as long as you can. You can squeeze, you can twitch the muscle on and off. You can squeeze and hold and slowly release. You can squeeze slowly and release fast. If you train the muscle in lots of different ways, it gets strong in different ways as well. As I stated, pelvic floor is not just the lower part of the pelvis. There's also a column of pelvic floor muscles that rise up through the pelvis, right up to the ribs. You can imagine this like a lift shaft or an elevator shaft if you come from America, and you can tighten these muscles sequentially all the way up. Imagine it like being the floors on a large shop or hotel as the elevator is going up the floor. A really good way to describe it is you shut the elevator doors and you pull the elevator up through the floors, indeed up through the body, piece by piece by piece, right to the top of the pelvic floor. You You can hold it there. You can release slowly all the way back down again. You can open and shut the elevator doors, basically squeeze and relax the muscles at the bottom of the pelvis. You can take the elevator halfway up and release. You can take the elevator all the way to the top, release halfway down, take the elevator back up to the top again. You can play around with the muscle control at different points in the pelvic floor all the way up. As I said, everybody should be doing these. Men, women, especially people that sit for most of their daily life. People who have a really good control of the pelvic floor can actually contract the front, the back and the sides sequentially. And anybody again can do this if they practice hard enough. And this has massive benefits in a lot of areas. Again, the stability around about the whole pelvis gets improved by this. The abdominal contents are held where they should do. Many women suffer from prolapse post-pregnancy because of a weak pelvic floor that's not trained properly afterwards. It can help with sexual function particularly because it increases control of the muscles around this area, and just into older age helps stability around about the spine and the pelvis and can help mobility and also abdominal control. So that's the core in a nutshell. It's not just your abdominals, it's the deeper stability muscles as well, including the pelvic floor. And you should, when you're training the core, you should pay attention to all aspects of this. Abdominal muscle exercises, deep control exercises, through Pilates and yoga, and also daily pelvic floor exercises. Thank you very much.